Okay, so last week we talked about answering the pain oasis question. Today we're going to touch on one of the ADL questions, and that's the ambulation question. And it's so crucial. In fact, I had this conversation with Barbara this morning because how you answer that question affects so many of the other questions that you have in the assessment. And if you don't answer it correctly, you're either going to drive yourself nuts going back and fixing answers because they contradict your ambulation question. So answering this one correctly on the front will make the rest of the assessment much easier to answer. Okay? So we're gonna ask the older Miss Sanders the question about ambulation. Okay? So, Miss Sanders, are you able to walk?
Oh yeah, sure. Okay. Sure, I can walk.
So I see your cane. Do you use your cane all the time?
Sometimes I don't need it, but I usually at least carry it with me.
When do you not need your cane?
Oh, when I'm in my home and I can reach out and touch furniture to get to where I need to go.
Why don't you show me how you walk with your cane?
Okay, I will.
There you go.
Okay, Miss Sanders, let's have a seat.
Oh, okay. Oh, my back.
Oh, Allie.
Oh, my feet. Oh, my arthritis.
Does it hurt when you walk?
No. Not
All right. Miss Sanders, do you ever use a walker?
No. I don't need a walker. No.
Okay. Okay, so what can we learn from watching Miss Sanders walk and the questions that she answered? So she tells us she doesn't use her cane all the time. Okay? When she gets up and walks with the cane, she's very slow. It's difficult to ride.
And she's also holding on to furniture.
She's very unsafe.
Yeah. So she's cruising. She's furniture walking. She's hanging on to the chair rail on the wall.
The best answer there is.
Yeah. So even if you think, ooh, this patient might need a walker, maybe they don't need a walker, but maybe they would be safer with a walker, then you have to consider that. The intent of the question is not necessarily, their ability. I mean, you can get these answers without seeing them walk, but it's best if you can. Okay? The answer is how they do it most of the time and how they do it safely. Okay? So if I'm just a new Oasis clinician and I'm reading these questions and it's just the first few times that I've seen them, Miss Sanders walks with a cane. She's a 1. Is that right?
No.
Okay, so why wouldn't the 1 be the correct answer?
It's not safe.
It's not safe.
There you go.
Okay, why else would it not be the correct answer?
It's not true.
Right, Jesse says that it also mentions stairs and uneven surfaces. Okay? For me to say that Miss Sanders can walk with a cane and she is a 1 on the Oasis assessment, that means that she has to be safe through all areas of her home, on different surfaces, and going up and down stairs. Now she can use a handrail, because it does say with or without a handrail. But she has to be safe and be able to do it without any assistance at all. And here's the thing, if the daughter is there and says, well, I don't let mom walk without me knowing about it, or without me being there, or being close enough to help her if she needs it, that's assistance, okay? That's not independence. Just because you're not touching them doesn't mean that that's not assistance. So ideally, her score would be what? A 3. She needs supervision or assistance at all times, okay? Whenever she's up and walking. You can assess that based on how stable they are, how hard it is for them to get up and down out of a chair, off the toilet, any of these things. And it doesn't take very long to assess somebody's ambulation. All the therapists are going to go in and have a patient walk. I mean, that's our gig. So we're going to get them to walk. But the nurses, you may be assessing so much else that it just seems like now I gotta have this patient walk. But usually, when you're going to home, unless there's somebody that you're going in and they've got a wound on their foot, they're not getting up, you got a chance to do it when they come to the door. I mean, we see so many patients that live alone. And you watch them walk back to wherever you're gonna sit, you can assess their ambulation right then. Are they unsteady? Do you feel comfortable letting them walk? Are you comfortable with going ahead and walking in the other room and sitting down and setting your stuff up while they walk back? If they're making you nervous, if they look unsteady, if they start to lose their balance, then they are not a 2, a 1, or a 0, okay? Now, answering this question is so important because if you go in and you say, okay, Miss Sanders was walking with a walker, she's a 2. And then the physical therapist comes in and says, patient's unsteady, requires men to contact guard assist to walk, safely. That same therapist would have most likely answered that question as a 3. Well, let's say nursing gets done, therapy stays in, and now here we come to go answer that question. And we've worked and worked and worked, and now Miss Sanders is 100% independent with that walker. She can get everywhere, in and out. She can get to her car. She can go up and down the steps. Whatever she's got to do, she can do with the walker. She is independent. And here we go to score it. Previous entry, 2.
Yeah.
Now, she's a 2 again. So at the end of all this, Miss Sanders has not progressed in her ambulation at all.
Question,
Okay?
was it, do you correct that? Whoever goes through that, when you guys check the, you drop
That's what
that
your
score,
scrubbers,
right?
that's
Right.
what your scrubbers are for, you're responsible to do them, but we'll send an M item,
Yes.
M notes.
What was yours, Ornette?
You go in, the problem is the wording on that G170 and the M1860. You pull your hair out trying to figure out how to get those two to make.
Right.
Like, it'll say walk with one-handed, device, walk with two-handed device. It doesn't say walk unsafely, walk.
You're right. It doesn't say unsafely, but read the question further. To answer someone a 1, they must be independent with a one-handed device. Whether it's a cane or a Hemi walker, they have to be independent. That includes going up and down stairs and walking on uneven surfaces.
What if they have no stairs?
Well, if they don't have stairs, that's fine, then that's not something you can assess. But would you feel comfortable if they came up on a curb? If they had to step up something, that they could do that with that cane and nobody even standing beside them? Could they go to the dollar store by themselves and get it out safely? So when you think, I'm gonna mark this patient a 1, they have to be totally independent with that device, okay? If you're walking somebody and they've got a rolling walker and they're tooling around and you're thinking, well, they're doing pretty good. They're really doing okay. Would they do okay outside? Would they be able to get up and down the stairs without any help? Here's a catch. You got a patient that's got a walker and they come to the stairs and they say, well, my husband takes my walker to the bottom of the stairs for me. Guess what? That's assistance. So they're not independent. If they were by themselves, they wouldn't be able to get down the stairs because they couldn't get the walker down to the bottom themselves. So they're 3, okay? Maybe that's one thing therapy is gonna focus on, is to get them off of the walker, get them to be able to go down the stairs independently. Maybe they live alone and it's a safety hazard because they couldn't get out of their house in the case of an emergency, okay? So when you're scoring somebody a 0, a 1, or a 2, they have to be independent, needing no assistance whatsoever. Otherwise, they're a 3, okay? But that's gonna allow us to work on that and show improvement and get them to where they're a 2 or a 1 or a 0. And we do have those patients, but if we start up there, we're not showing any kind of improvement at all. And if you truly think this patient is a 1 or a 0, then you have to question if therapy is ordered.
That's right.
Do they really need it? Now, there are times where, yes, that's the case. That patient is totally independent with walking, but they've had shoulder surgery. And it just, they need OT in there to work their shoulder, but they can get around in the house. So they probably don't need PT, they just need OT. So it does happen, but it's very, very rare. And, you know, we're gonna have patients that don't make any improvement at all. We're gonna have patients that need constant supervision to walk from the beginning, and they're never gonna get beyond that. And those are the ones that we just have to eat. We can't shoot ourselves in the foot by the people that are gonna show improvement, scoring them too high on the front end, okay? Now just briefly, you brought up the GG questions. When you answer this question, it affects so many other answers. Now, if you answer someone a 2, okay, they are independent with a rolling walker. According to the assessment, that means that they would be able to access and get their medications, okay? They would be able to access and get their own clothes, okay? All of those things, they would be able to do. So if you're gonna mark them a 2, then all those other questions, they get scored higher as well. If you don't, if you say, oh, this patient needs their clothes set out for them, but they can put their shirt on, they just need somebody to get it out and lay it on the bed for them. But yet you marked them a 2, which tells the assessment scrubbers, wait a minute, you just said that they could walk independently, why can't they go get their own clothes? You see how they connect? And when you get to those GG questions and you start answering and you say, well, this patient is a 4, but you just marked them a 3 that they needed help all the time when they walked. You know, yeah. So they're gonna say, are you sure? Are you sure about this answer? You know, they probably need more assistance than that. So if you answer them more accurately on the front end, you won't have the headache of hitting that PPS plus scrubber and going, oh no, you've got a list of things that you have to go back and correct, okay? Medications is another one. You know, if you're gonna score that a patient is independent with their or they can use reminders, let's say that. They can take their own medications if they have reminders, but they're a 3 with ambulation, and they're a 2 with dressing, and they're a 2 with toileting. If you say that they can do their medicines, you're gonna get it kicked back at you, and it's gonna say, wait a minute, how do they get their medications? Because that's part of the question. Can they go get them? Can they, wherever they are? If their medicines are in the kitchen or in the bathroom, and they're in the living room, how do they get their medications? Okay? So you have to consider all those things, and when you start thinking, okay, if I'm gonna mark this person a 3 on ambulation, then I'm gonna mark them a 3 for their medications because they can't go get them. Even if they can tell you every possible drug they take, how often they take it, how many milligrams it is, they show you their chart, they can recite it from memory, they can tell you when Dr. Jones DC'd this medication 3 years ago, everything, they're still a 3. Because you said they couldn't walk without supervision, so they need help to get their medications.
Could you briefly touch on the GG ones, where the difference between 3 and 4, and where standby assist? I think maybe standby assist might be something good to go over with everyone.
Right, so on the GG questions, a 5 on those questions is supervision. Meaning, you know, I don't have to touch you, I just have to be able to either see you or hear you, but I'm gonna know that you're up in case you have a problem. No physical assistance whatsoever, okay? So you really wanna start focusing on a 4 or lower, okay? Mainly 4, 3, and 2. Because if you score somebody a 1, you're telling them that they're completely dependent. They can't do it by themselves at all. They completely 100% rely on another individual to take care of whatever task it is you're scoring. Okay? So with the GG questions, always make sure that you're looking at the level of assistance. A 3 means a little bit of assistance, that the helper does 25% of it. A 2 means they do 50% or more. So when you're saying that a patient needs physical assistance to walk, then for those walking GG questions, you would score them, you know, a 3 or even a 2.
The eating independently, that's the one that gets me. A lot of them can eat.
Yeah. What?
If someone puts the food there. Is
But-
that still a 3?
But that's.
Yes, but hold on, we'll answer that one in a minute. We'll wrap up this one on ambulation, okay? Any other questions about ambulation?
And next week we'll talk about bathing and maybe get some occupational therapy help with that one too. So thanks, everybody.